Hey, Martha and Lori. So I decided to take a little bit of a different approach with the discussion board this time because it's just the three of us in the course. So how cool is that? You get a little bit more intimate, more personal approach, right, to your educational experience. So hi, and welcome to week one in your first discussion board post. So kind of interesting, right? That first chapter kind of opens up to the roles of the nurse educator, those within kind of two areas, right? Within nursing education, within higher education, and then that within the clinical practice area or within the hospital setting is what we kind of refer to. So two different things, I guess, for me and my background, a little bit about me. So I was a first generation college student, came out of a baccalaureate degree and started in an emergency room setting. So I had a really great experience with an internship between my junior and senior year of my undergrad experience with the Department of Veterans Affairs. And because I did that experience as an internship, they allowed me to, unconventionally back in the day, remember we always had to pound the pavement. We were telling our new grads coming out, you have to do medical surgical, you have to have, X amount of years of experience. And so, with me getting that rotation and staying on my senior year as a senior nursing student there, they let me go into a large tertiary site in Indianapolis, Indiana, into the ER, which was awesome for me as a new grad and really exciting. So I took that opportunity, worked for about a year and a half. I was working right from my undergrad BSN into my master's degree in administration. So I was working as a permanent charge nurse in the ER for the VA, getting my master's degree. And then at the end of my master's degree, they said, look, this VA currently is on what we call a hiring freeze. And so if you want to go upwards and beyond in the world of management, you're going to have to move around a little bit with the VA. And we have a couple of spots open right now. We have an emergency room nurse manager open in White River Junction, Vermont, Cincinnati, and in Las Vegas. So Vermont was the only place that I had never been before. And so that's where I went. I went to Vermont to a really small 10-unit ER, bed hospital. So it was really small, but it was a great opportunity for me as a new nurse manager, right, to kind of get my feet wet. But I tell you that to tell you this. So while I was up there and, I was single at the time, this was before kids, before being married. What was nice was that Norwich University had a really nice private military cadet academy, and they needed clinical instructors, educators. And, I'd worked in the ER for a long time. I had did other medical surgical experience. And then as an ER manager, my nurses also were house supervisors on the off tours. So what I did was I picked up a clinical rotation because we had an agreement, a clinical affiliation agreement with the university to lend instructors, right? Those master's prepared nurses that could pound the pavement as clinical instructors. So I remember having my first little group of 10 students on this med-surg floor at the VA, and I fell in love with it. So it was my first exposure to, education within higher education. I had always done some sort of education within my job as a nurse, right? That role as an RN, we educate clients and patients all the time. But this was different, right? I was the sole person responsible for the hands-on, clinical sets and clinical outcomes of this course for these students. And so it was really cool. And I just continued to do it. I transitioned from those clinical, adjunct rotations to going into doing some theory courses, fundamentals, and those types of things with a couple other universities, and then transitioned into online teaching as an adjunct when I started my terminal degree. I was doing my DNP degree at Chatham University. And I did it as a way really just to supplement my income, which was awesome because I was working online. And so, I'd work, for the VA, Monday through Friday, and then I'd get off and then I'd get home and I'd do my grading and I would facilitate learning on the online environment. And I really, really enjoyed it. So after I got my doctoral degree completed, that's when I left the VA and I went into higher education full time. So for me, obviously a separation of roles, those that are hospital based, and I'd always worked with full-time hospital based educators, particularly we had case managers, educators that were full-time in things like diabetic management, congestive heart failure. The VA was really good about having care managers and secured educators within certain areas. So within primary care clinics, I always had coworkers or colleagues that, were in primary care, but then after they get done with their primary care, seeing their, primary care provider, they would move them over to another clinic where they would be provided solely with just education, right? So I had exposure to both, but for me, my route was higher education. I really liked the academic nurse educator a little bit more. And I think it was because I really enjoyed working with students. I was, even in undergrad, I found a little bit of a calling with, being a tutor and what we called supplemental instructors. And so I was a note taker, and I was kind of like a course lead in several courses. So I kind of always felt like I was a natural teacher. I was able to, at an early age, break down information for people that was a little bit easier to understand. So I kind of felt like, education was a good fit for me. And I had the clinical experience now that I thought I could bring to the arena within teaching. So I've taught within both undergraduate and graduate programs. I love both. I always kid my students that I never know who's whinier, the undergrads or the graduates, right? You guys, everyone has their own sets of problems, right? Undergrads tend to be more of your traditional, 4-year degree students, whereas graduate studies, I have everything. I've got anyone from, 22-year-olds all the way up to 69-year-olds. It's awesome. I love the variety and the diversity of it. So it has served me really well. And so again, why ask, why choose one or the other? For me, it just felt like just a really good fit. I can always see myself in both roles. And I think even as a nurse educator in higher ed, I'm always still a patient educator, right? Because I still have my hand in practice. I think that's also important. If you do choose the academic educator route, it's typically always important that you keep your hand in practice. And so at my university, where I'm at full time, we get a release day for practice. And so I still pound the pavement as an ER nurse. I'm certified as a trauma nurse. And so there's a lot of different things that I still do. And, really your practice experience is going to help you, but your life experience does that too, right? I mean, some of us, this isn't a first career choice for some of you. It may not be. I know I've had a lot of friends who, worked in areas like HR, or I had somebody that was an attorney and switched to nursing. I mean, it's so neat, the life experiences that people can bring to the table. So that's kind of my story and kind of how I became in the nurse education realm. And so I thought this would be a fun way to kind of deliver that to you. So what I hope to do throughout the week, since it's just us, is I'm going to throw up some videos like this so you can kind of see me. And you can see I'm at home today. See, there you go. I'm in my lumberjack wear here. It's cold here in Indiana, but it's also one of the reasons I chose to be an academic educator as well, and why I love online learning, because I have a lot of flexibility, right? I'm here at home. I've got something in the oven, and I can sit back and I can talk with you, and I can grade and I can give feedback. And it's a great, just a great life. I'm incredibly blessed every day to do what I do. So I hope you guys feel the same way. And I can't wait to continue on with this course and share more ideas and more inspiration for you that you can take and utilize in your own practice. So thanks, guys. Have a great weekend. Bye-bye.